Hi, my name is Tina Gooding, and I'm doing my community needs assessment over my community, Lamar County, and it's over mental health. First, let's find out what mental health is. Mental health is defined as the social, emotional, or psychological well being. It determines how we relate to others, handle stress, and make choices. Mental health affects how we think, feel, and act. Mental health is important at every stage of life, from childhood and adolescence through adulthood. If one experiences mental health problems, their mood, thinking, and behavior could be affected. A mental health condition isn't the result of one event. Research suggests multiple linking causes. Genetics, environment, and lifestyle influence whether someone develops a mental health condition. A stressful job or home life makes someone more susceptible, as does a traumatic event. Biochemical processes and circuits in basic brain structure may play a role too. There are numerous mental health conditions. Those could be depression, anxiety, ADHD, bipolar, schizophrenia. There are numerous mental health diagnoses. Examples of some signs and symptoms for mental health issues are feeling sad or down, confused thinking, or reduced ability to concentrate. The reduced ability to concentrate you often see with ADHD. Excessive fears or worrying or extreme feelings of guilt. Extreme mood changes of highs and lows, which is something you often see with bipolar. Withdrawal from friends and activities, significant tiredness, low energy, or problems sleeping, which is something you see with depression. 1 in 5 U.S. adults experience mental health illness each year. 1 in 25 experience serious mental health illnesses each year. 1 in 6 U.S. adults aged 6 to 17 experience a mental health disorder each year. 50% of all lifetime mental illness begins by age 14 and 75% by age 24. These are some statistics for our county, Lamar County. The average monthly number of students referred for mental health issues at the school per school in Region 8 is 8.54. Mental health providers to population is 1,301 to 1 provider. Percentage Lamar County population on mental health medications is 20.1. Number of suicides in Lamar County annually is 11. For the state of Texas, it is, that's for Lamar County. The number of mental health providers is 98.9 per 100,000 population, which is significantly lower than the national average. Approximately 19 people per 100,000 population in Lamar County die by suicide. For the state of Texas, that number is 12 per 100,000, so you can see we're significantly higher. Many believe that the current system of mental health services in Lamar County is not adequately equipped to respond to the mental health needs of veterans, the aging population, and the youth. There are no mental health hospitals in Lamar County. They have to get sent to neighboring counties, which one is about 2 hours away. The other one's about 3 hours away. In this past year, we've had several youth that committed suicide, one being a student in my daughter's grade as sophomores, which had a significant impact on our county because they were all pretty close together. In a recent interview with a practicing pediatrician, Dr. Aubrey Gibbs, that practices here in Lamar County, she said that she sees an average of 15 children in a week in her practice that need psychiatric services. She is one of 5 pediatricians and 2 nurse practitioners that work in her clinic. So if she's seeing that many kids, with however many the other one's seeing, that's a fairly significant number. She says there's not enough pediatric psychiatrists within a 200-mile radius to treat all these children that they're seeing. She said what is available is very busy, that there's usually a 2 to 3 month waiting period to get in, and those that are being seen are obviously the worst of the worst kids to be seen. She said that most of these kids do need medication, and so we do have a fair amount of therapists and counselors in Lamar County, but they're unable to prescribe medications, and she says these children need medication. She said she sees it as a twofold problem, meaning she's seeing all these children, that have mental illness, but also in seeing them, she's seeing in the parents that there are some mental health issues, and that the problem with that is those parents don't have either insurance or the money or both to be seen, and so it's hard to treat a child when the parent is having mental health issues themselves. I did a survey on Facebook for Lamar County residents I asked 6 questions. Does your insurance cover mental health? Of those, 69.2 said yes, 10.3 said no, and 20.5 said they had no insurance. Have you accessed mental health services? 25.6 said yes, 74.4 said no. Do you know someone who suffers from mental illness? And that was broke down in, do you know 1 to 5 people? That yes was 79.5, 6 to 10 was 7.7, 11 to 15 was 2.6, and no was 10.3. The next one was, do you know how to access mental health services? 69.2 said yes, 30.8 said no. Is cost a deterrent from accessing mental health services? 51.3 said yes, 48.7 said no. Is availability an issue for accessing mental health services? Yes, 41%, and no, 59%. This is 2 graphs. This one shows from 1975 to 2015, the solid line is males and the dotted line is females. You can see around 95 or so, we had a pretty big increase in the males, and then we've seen a decrease, but now we're seeing, and this is 2015, we're seeing a significant increase, both females and males, in the amount of suicides, and this is rates per 100,000 population. This shows the different colors as the different levels of death rates per 100,000 by suicide, in all races, all ethnicities, both sexes, all ages. The annualized crude rate is 11.42. Lamar County is in this little dip right here, and you can see it's right there. And so for that number, we are 17.6 to 36.26, which is a pretty significant number. If you know anyone who suffers from mental health, or if you're having thoughts of suicide, there is a suicide number hotline, 1-800-273-8255. Of course, if you feel it's in dire needs, you can call 911. What can we do as a community? We can be supportive. We can take notice of your family and friends. If you see them showing the signs and symptoms of not being with their friends, staying home, looking like they're feeling sad, talk to them, see if they need help. Try to help them find, help if they need to get in to see someone, or just talking. We need to be more vigilant and pay attention to what's going on with our friends and family. I feel like mental health illness, as says the pediatrician I talked to, that this is an epidemic in our country, in the United States, and in our county as well. I appreciate you listening to me today. I hope this has shown you how things are in our county, and it's given you a little bit of information about mental illness. Thank you.